Before penicillin was discovered in 1928, up to a third of deaths were caused by bacterial infection. More antibiotics followed the discovery of the miracle drug, saving millions of lives and dramatically increasing average life expectancy. But soon after the release of new antibiotic treatments, bacteria started fighting back by developing resistance to them in an evolutionary arms race for survival. Antimicrobial resistance, or AMR, develops when bacteria, viruses, fungi, and parasites evolve to resist the effects of medications, making infections harder to treat and increasing the risk of disease spread, severe illness, and death. AMR is a growing global threat because the overuse and misuse of antibiotics in humans and animals has accelerated this process, leading to infections that standard treatments are increasingly unable to cure. Because of this, medical facilities around the world are at the front line of a critical battle against AMR, trying to prevent patients dying from drug-resistant infections and countless more suffering complications. However, deaths linked to these infections are expected to reach 10 million per year by 2050. By comparison, COVID-19 has caused just over 7 million deaths since the beginning of 2020. Indeed, Dame Sally Davies, the United Kingdom's Special Envoy on Antimicrobial Resistance, warns that infections caused by resistant microorganisms will make some of COVID look minor if action isn't taken, and refers to AMR as the silent pandemic the world needs to deal with. Hospitals play a vital role in the fight against infection, but they are also a source of healthcare-associated infections. The potentially life-threatening HCAIs contracted in hospitals are often spread by failures in infection control practices. So there is an urgent need for clinical facilities to adopt more effective infection prevention protocols and tools. This is why a growing number of leading hospitals are turning to a potent weapon in the fight against infection, called Fantex. Unlike traditional antimicrobial agents, which only kill pathogens upon initial application, Fantex provides rapidly effective and long-lasting protection against contamination, effectively breaking the chain of transmission. With its unique formulation and best-in-class speed of kill, Fantex helps to prevent the transfer of pathogens, significantly reducing the risk of healthcare workers or patients contracting potentially life-threatening HCAIs. Fantex is highly regarded among clinicians who recognize the global need to prepare for pandemics, prevent infection, and conserve antibiotics. Because unlike any other kind of drug, the more we use them, the less effective they become. Antibiotics are fundamental to the delivery of modern medicine. Without them, it will be too risky to perform many life-saving operations, such as organ transplants, cancer chemotherapy, and common surgical procedures such as hip replacements. Even childbirth and the care of preterm babies will become much more dangerous. To conserve them, we need to prescribe them less frequently by preventing infections wherever possible. The adoption of Fantex in clinical practice helps healthcare facilities to slow the spread of antimicrobial resistance for the benefit of patients. Hygenica, protect the patient.